talk about a procedure for women who are premenopausal and no longer want to have children. It is called cryoablation therapy, and it freezes the lining of the uterus. Here to tell us more about this procedure is Dr. Robert Rubino, an OBGYN practicing physician in New York City. Welcome, Dr. Rubino. Welcome to the show.
Thank you.
I think to get started, what is this procedure? Can you explain sort of freezing the lining of the uterus? What's it all about?
Well, it's a relatively simple procedure, and that's what happens. You essentially freeze the lining to death. You know, it sheds for the final time, and women either have no period at all or a very light manageable period. It's for women who have problematic, heavy, painful periods, and it's essentially an alternative to either hormonal therapy or hysterectomy, and it works quite well.
I understand that the FDA approved it, I think it was in 2001. I'm curious, how widespread is it? Is every OBGYN able to do this? Do they have the equipment, or is this a very specialized procedure?
Well, it's a specialized procedure. While it's available to any OBGYN, there's specific training involved and a skill set that you have to be comfortable with. It's the only FDA-approved procedure for the office. And it's relatively painless. At our offices in New Jersey, we're the only one around the area doing it. But we've done over 100 patients and have about a 90% success rate.
I guess people are thinking, are there complications? I know when we talk about other non-invasive ways, there's sometimes the risk of, could you perforate, cause a tear, a hole, something, you know, that could be more serious than just eliminating your period, let's say.
Certainly, and the main risk is poking the probe through the back of the uterus. But that's the thing I like about the procedure, is its safety. It's done under direct 3D ultrasound guidance, so you're virtually watching the procedure while you're doing it, whereas the other forms of ablation are somewhat blind procedures.
Right. Who would be, if you can imagine, who is the best patient that might be interested in this procedure, if you could kind of describe a typical patient?
A patient with heavy and or painful periods who's done with childbearing is an ideal candidate. So usually that's anywhere from age 25 to 55, and they cannot have any uterine malignancy. It's only for benign conditions.
Right, so you would do a biopsy ahead of time just to rule that out, I presume?
Exactly, and you know, patients with fibroids are good candidates, or adenomyosis, which is a condition of just heavy painful periods with no obvious pathology.
Right, right. No, this sounds very interesting. I think something a lot of women want to hear about as an alternative. Again, thank you, Dr. Rubino, for giving us your time today. Really appreciate it.
Thank you.
From all of us at the Healthy Life production team, we wish you good health.